Today I want to talk to you about corporate dentistry. It's a fairly new concept, and by new I mean over the past 25 years for some of the traditional corporate chains that you might have heard of. But in the past 5 years, corporate dental chains have exploded onto the scene in many large U.S. cities. So what caused the change from boutique practices or into corporate dental chains? Or better yet, what should I should say, what caused the transition? And it is on the increase. So there's two things that happened. Investors weren't making enough money in traditional investments. So a group of really smart investors got together and realized there was a lot of profit in dentistry. So they joined together and came up with dental corporations. Being a capitalist myself, I have no problem with this idea of dentistry for profit. Any small business wants to profit. So I'm not going to condemn them for wanting to have corporate profits. But the problem I have with corporate dentistry is that it's misleading. Some of the investors are dentists. So the dentists do the advertising and they come on and they talk about how they personally deliver care in their offices, or they suggest that their concepts have been utilized in their offices and that they're delivering it themselves. That's the way many of the spokespeople sound when you hear these commercials or you see the billboards. So the idea of corporate dentistry is to attract as many patients as possible. So they accept all insurance plans, which is great. At the surface, it seems like a great thing that they accept your plan. The other thing that's caused a rise in the corporate dental model is that dental students get out of dental school now with sometimes $500,000 or more of educational debt. In fact, I just read an article a month ago about an orthodontist in Utah who had finished his undergraduate, his dental school, and his orthodontic residency, and he was just a touch over $1 million of educational debt. And in the article he was lamenting over how in the world he was ever going to pay it, and he admitted that he just tries to never think about the debt and go on about his business the best he can. So when a dental student gets out of dental school with $500,000 of debt, they aren't going to qualify for a loan, and they are not going to be able to open their own private practice. So this has driven the corporate dental model significantly. They hire young dentists right out of dental school for the most part, and they pay them a very competitive salary, and they incentivize them on how much dentistry they find and how much dentistry they do. So you can imagine when that's the goal of everybody, including the investors, making more money, then you're going to have a suspicious scenario or situation about treatment planning. So in my practice, I see many second opinions from patients from many offices with very aggressive treatment plans. They didn't believe they had that much work to do, and they were smart enough to seek a second opinion. Most of the time with those plans, it's at least half of the treatment that I think they needed based on their plan from another office. So the consumer, I guess it's a buyer beware message as much as anything else. The other thing about corporate dentistry that I'd like you to understand is that they have millions of dollars for marketing. So you're going to see them on television, radio, newspapers, magazines, Valpaks. They're going to be everywhere. They're going to saturate the market, trying to bring in as many patients as they can. The average corporate dental office spends between $100,000 and $250,000 per month. I'm sure you thought I was going to say year because the numbers just seem mind-boggling. So at that, what is that, $1.2 million to $3 million a year on advertising. So the more offices they have, the more marketing dollars they spend. It's a pretty simple business model, but I want the consumer to understand that in most boutique practices, you've got one investor, and that's the dentist. We make all the decisions, and we try to create an environment where everything is patient-centered, that the patient comes first, and whatever profits we have at the end of the month or year becomes our salary. So we are the investor, we are the decision maker. And that's an important concept to understand when considering which office you're going to choose for your dental work.